Now that we went through DOMAs, is this more intimidating?
Sorry?
I said, now that we already went through DOMAs, is this more intimidating or you're good?
Who? Sorry.
Oh, for Yoobin.
Oh,
I mean, it was a pretty good presentation, so I'm a little intimidated, but that's okay.
Oh, don't be. You'll be perfect.
you're on mute.
Okay, am I still muted?
There you go.
Nope,
Okay.
you're good.
Okay, sorry, my computer has been lagging. Um, one moment. Okay. Hi, everyone. My name is Yoobin. I'm the CEO and co-founder at Quip Medical, and we're bringing the joy of medicine back to physicians. I think we can all assume that doctors like talking to patients, or at least most of them do. And if you're a family doctor, you like asking them about how the kids are doing, how that vacation was, or in my preceptor's case, about golfing. But as administrative burdens have continued to rise, the luxury of small talk has turned into a luxury that can no longer be afforded. The reality of today is that physicians waste 50 hours per month on unpaid paperwork. Now, should physicians choose to fill that time with additional work, that is a lost opportunity of 150 patient consults. To put things into perspective, that's about $9,000 worth of a physician's time spent on something you do not need a medical degree for. And we want to fix that. Quip Medical has built the first true end-to-end clinical documentation ecosystem. By using patient encounter notes to automatically suggest all relevant billing codes and maximize physicians' profitability. To begin, doctors simply press the mic at the center of the screen to start a recording. And from there, doctors can take the time to look at the patient and genuinely listen to their concerns without worrying about documenting the consultation simultaneously. At the end of the assessment, physicians stop the recording to initiate processing of the summary note. And this summary note is automatically synced to our web app, from which physicians can seamlessly copy into their respective electronic medical records with one click. From our web app, physicians then have the option to retrieve all relevant OHIP billing codes based on the scope of the note. At the end of the day, doctors are more present, patients are happier, and notes are more precise. So what makes us different? Doctors have told us time and time again that Quip offers an easy, intuitive user experience, especially in comparison to the various competitors on the market. 100% of our customers, even the ever so slightly technologically challenged ones, have been able to integrate Quip into their workflow instantly. When dealing with patient data, security and privacy are top of mind for all stakeholders, whether that be the CEO of the hospital or an individual physician. Not only do we follow the standard PIPEDA and PHIPAA regulations, we of course also provide end-to-end encryption of patient data. But unlike our competitors, we even go the extra mile by de-identifying transcripts prior to the processing of notes. Finally, our new billing feature ensures that codes are limited to the context of the consultation and also guarantees that doctors aren't missing out on money that they should be getting paid. We are the first Canadian AI scribe to offer this additional feature. All in all, it's the best value you'll find on the market. We don't hide any of our features behind additional paywalls because we want to ensure our users have access to the full ecosystem as well as unlimited customer support within minutes. And our users are already seeing the benefits. The canceled dinner plans, missed good nights to kids, poor patient rapport, all now prevented with the use of Quip. We currently have 30 beta users on our platform across both Canada and the US with 0 churn thus far. In addition, we've recently partnered with the Department of Family Medicine at the University of Ottawa to pilot our technology. And this partnership alone allows us to service a potential pipeline of over 100 affiliated providers across the city. To date, we've generated more than 4,000 notes across 5 clinics, demonstrating a time saving of more than 400 hours in total. Despite our rapidly growing user base, we've been able to remain profitable since launch by maintaining a low unit cost of less than $2 per user, priming us well for scale in the near future. We currently offer 2 business models, depending on the consumer profile. For individual physicians or small clinics, we offer a monthly subscription model, while larger family health organizations or hospitals can contact us for a custom enterprise deal to negotiate annual licenses. From each of these models, we currently have an MRR of $2,000 and $50,000 more in ARR currently in the sales cycle. Oops, sorry. With 5.2 million potential users encompassing physicians, nurse practitioners, physiotherapists, and other allied health professionals across both Canada and the US, we are currently targeting a $9.4 billion serviceable attainable market, with avenues to eventually target a $25 billion market globally in the near future. I would also like to take this moment to emphasize that these estimates are only expected to grow as we see a compound annual growth rate of 25% in the global digital health market. Looking forward, we plan to launch with more clinics and hospitals, as well as establish strong partnerships in complementary markets, such as patient management platforms. Not only have we agreed to launch pilots, but we are also in talks to launch quality improvement and research studies, develop French integration, and provide adaptations for use in retirement homes, as well with the University of Ottawa. To support this, we've begun integrations with Point-Click Care, the #1 EMR for long-term care homes. Now, surprisingly, 90% of residents in long-term care facilities of Ontario fall under the responsibility of family doctors. That's about 120 patients per doctor, oftentimes in addition to their regular family practices, a burden mitigated with the use of Quip. Furthermore, while rudimentary personalization for different specialties is currently available on the market, customization on an individual level is not yet widely accessible. With your support, our personalized documentation, billing code optimization for Medicare and Medicaid, as well as countless other features in the pipeline, could expedite our expansion into the markets listed here on the screen. Now, none of this would have been possible without the support of our amazing team of engineers. I don't know why the logos are not showing up, but I promise there are logos there. Our CTO has years of experience and publications in AI research, as well as its applications, and currently leads the AI model development, evaluation, and other related tasks for Quip Medical. Our software development team seamlessly integrates these models into our mobile and web app, and it is because of their expertise that we've successfully built all of our core technologies 100% in-house. Despite the challenges and stressors of startup pace and culture, the majority of this team were all students of either biomedical engineering or medicine when all of this was happening. But both Brian and Tremaine have graduated since then from the University of Waterloo this past summer, and we expect to see even more rapid growth in the months to come. I distinctly remember, sorry, I don't know why none of these are showing up. Sorry, I'll continue. I distinctly remember the day I became disillusioned with the field of medicine. It was my first day in clinic as a first-year medical student. And I thought, today's the day. I get to talk to real patients. Today's the day I get to learn how to be a doctor. And instead, I learned how to write notes for my preceptor. I understand why documentation is important. In fact, it is essential to quality patient care. But with this technology available today, why are physicians still forced to remain glued to their monitors when they so desperately want to look at you, the patient, instead? I didn't go to medical school to write notes all day. I came to help and connect with people, and I can assure you that doctors feel the exact same way. Thank you.
Thanks, Yoobin. Good recovery there.
Sorry, I don't know what was happening.
Oh, stuff happens, eh? Little gremlins on the
Yeah.
computer. All right. Okay, so how about we start off with Nina for some feedback on this one?
I have additional people here to help us.
Very
Sorry.
good. Hi there.
I think at the beginning, overall, really great. I see that there's some good slides that we missed because it was throwing you off. At the beginning, I think maybe a high level overview of maybe the industry might be helpful, just because I think an investor's natural reaction to anything medical would be, what's the compliance involved? You know, like, do we need FDA approval? You know, what's it going to take to implement this? Because when we're talking about, you know, AI in a doctor's office, there's probably hoops to jump through.
Yeah, definitely.
Yeah, I like how you went through your revenue. I like how you talked about additional revenue streams, like the long-term care model. And on your team slide, I think that's where your slide started misbehaving. I don't know if you have names or not, but I think it would help the investor feel like connected more if there are names. It wasn't showing up. So
Yes, I think, can you?
oh,
Yes, sorry.
now there's more logos showing up, but still no names.
But not name. But not name.
Yes, sorry, I don't know why that's not showing up, but
No
I
problem.
will make
Yeah, names
make
would
sure they're
be good.
included.
And then I wasn't sure what SWE stands for. So I
Oh,
think you could,
sorry. Okay.
I think that you
Yeah,
could
I was gonna say that that's an engineered term. Yep.
I think you could assume, you know, like, people are not coming from a specialized background. They're more generalists, and acronyms
For
should
sure.
be decoded.
Okay, for sure.
All right, thanks, Nina. Shelley, do you want to weigh in with some feedback for Yoobin? No, maybe Shelley's in transit still. Martin, how about we go to you?
Yeah, this guy's good overall. I like the direction. I've actually seen a number of similar kind of companies, and I really like your approach, both your approach and the way you pitch it, best of anything I've seen. So great job.
Thank you.
Couple of thoughts. I felt like getting started was a little bit like you were really smooth in the center. The start was a little rockier, and I got a mixed message. Like, you talked about how doctors want to talk to patients, and then you talked about how they'd be able to process more patients. And I think I actually know what you mean, but that was it. It felt like a mixed message, and second, it was kind of third party. It wasn't a very personal story, and you actually came to a very personal story about yourself at the end, right? When you talked about the whys. Like, I would bring the personal story, and be clear on the message about how this enables, and I don't know which way, like, is the message that it makes being a doctor better, or that they're going to make more money? Like, I don't know that you can have it both ways. Yeah.
That's a good point. Okay.
Then a couple other, like, these are all smaller things. Oh no, one more, two more bigger things. In the team, you talk about this team, but like in the space you're in, your mentors are probably pretty important here, or coaches. You know, like, do you have an advisor that's kind of like, part-time chief medical officer as you go into this market, and think about, like, compliance, as Nina said, but also almost every government in the world is in the middle of writing new regulations around the use of AI, which may affect you right in this kind of space. So I don't know, maybe think about how you think about the other part of your team and present that to investors, because that's important. Not just your core team. And then I thought and maybe the message here is to pull some of this together, but there was, you talked about usage, and then like one slide later you had the number of users. So I was wondering how many users there are, but then the users were later. And then you talked about MRR at 2K. Are you making 2K MRR with 30 users?
Mhm.
Okay, that's great. But the $2 per, you also had $2 per user. I assume that's $2 per user per month in cost.
Yes.
Yeah. So I would consolidate that message, right? Like you have
Okay.
users, what's your acquisition cost? What's your monthly cost? Like you have some really good data, financial data there about how the business model works and how it's going to scale. But I had to piece it out of different parts of the pitch. So I would make that crisp, especially because it's a
sure.
really strong message, right? Between the current margins you have and the stuff you have in the pipeline. I think it's super, super strong message.
Awesome. Thank you.
And then I have one more if no one else wants to. It's just a minor thing, but like the testimonials are great, but you didn't go through the testimonials in the slide, and I didn't have enough time to read them. So that was like
Okay.
I don't know, if they're good and you want to include them, like speak to them and spend time on them. If you're gonna skip over it, then it's mine.
Okay, thanks, Martin.
Good point.
Yoobin, if you want to email me the deck, I'm happy to flip through it to, look at it and give you any feedback that comes up for
Oh.
me.
Thank you so much. Yes, we'll do.
Just to add my 2 cents, I was going to make a mention of the same thing that Martin did about your personal story that you brought up later. To me, that would be a much stronger beginning. My first day of
Okay.
whatever, I was so excited. I'm going to, talk to patients. I'm going to save lives, whatever. And then I do paperwork all day. Like, I think that would make a stronger
Yeah, that's
and
a great story. That's a great
personal.
story.
Yeah. Yeah.
For sure. Okay. Thank you.
Let me just see if Shelley's able to weigh in here. Okay, so maybe she's not able to. All right. So I am going to stop that recording. Thank you, Yoobin.